Good morning dear students. Today's topic is hypoplastic left heart syndrome. What is hypoplastic means? Immature development of a cell or organ. What happened here? The hypoplastic left heart syndrome. Here the left heart means left ventricle is not well developed. It is a structural congenital abnormality of the left side of the heart is there. Okay, how? Because of this hypoplastic left heart syndrome, the aorta is arising from the left ventricle. No, what happened here? This aorta is having abnormality. So in the early neonate, there is no signs is there, signs of cyanosis is there when the patent ductus, because the patent ductus arteriosus is open. When it is closed after delivery or after birth, baby age at 2 to 3 weeks of gestational age, this ductus is closed. Okay, that time only we will recognize the child is suffered with the cyanosis. Okay, so before that we can't recognize that baby is suffered with this hypoplastic left heart syndrome or not. Okay, all of you clear? Nothing is there. Hypoplastic left heart syndrome means the left side of the heart was not developed well. The organ will not developed well. So the left side of the heart means the left side of the heart, that is the left ventricle, is not developed well. At the same time aorta also is not functioning well. Okay, this is about the hypoplastic left heart syndrome. Coming to the introduction, that is the hypoplastic left heart syndrome, that is the HLHS, is a consultation of left heart. Okay, here the abnormalities that includes the following, that is critical mitral stenosis or atresia, hypoplastic left ventricle, and critical aortic stenosis or atresia is there. Okay, what are the three conditions is there? That is critical mitral valve stenosis. Here the mitral valve is there, no, in between the left atrium to left ventricle, that mitral valve is there. So that stenosis is there. At the same time hypoplastic left ventricle is there. Look at this here. In this image hypoplastic left ventricle is there. Underdevelopment of the left ventricle is there. So what is the structure of the outline of the heart? Left side of the heart is there, no. See here it is an abnormality is there. So that is hypoplastic left ventricle is there, and then critical aortic stenosis and or atresia is there. Here the aorta is how it is there. Atresia, sometimes it is having atresia, and then it is having narrowing also is there, stenosis also is there. Okay, this is about the introduction. And here the hypoplastic left heart syndrome, it is because what happened here, hyperplasic ascending aorta. Here the aorta, here this is ascending aorta. What happened here? Hypoplastic, this also is underdeveloped is there, development is there in the aorta. And what happened here, the with the severe coarctation of the aorta is there. Here the coarctation is there, that the necrosis is there, coarctation. Here the structural deformity also is there in the aorta. Okay, ascending aorta is having coarctation. And hypoplastic left heart syndrome accounts for 1% of the congenital heart disease. It is the most common cause of death and then cardiac defects in the first month of the life. Why it is occur means because left ventricle is having the oxygenated blood, and then aorta has to pump the blood to the body. Okay, remaining parts of the main parts of the organ or body. Okay, but what happened here, the left ventricle is having structural deformity, that is a hypoplastic is there. At the same time the aorta is also having narrowing, ascending aorta is having narrowing, and then here ascending aorta is also having stenosis. So here it is one of the leading cause of death in first month of the life. Okay, this is about the introduction. And coming to the pathophysiology and the etiology, the left side of the heart is underdeveloped. Okay, and essentially non-functional. Okay, so left side of the heart is not function well. The right ventricle supports the pulmonary artery and the systemic circulation. So that side it is normally going on. An atrial septal defect allows the blood flow from the left atrium to the right side of the heart. So here the child is suffered with the atrial septal defect also is there. At the same time, blood flows to the right to left across the patent ductus arteriosus and into the descending aorta and deliver the oxygen and the nutrients to the body. Okay, that is normal process is going on. What happened here? The patent ductus arteriosus is open up to 2 to 3 weeks of the life. So there is a mixing of the blood is there. So oxygenated blood and then here the nutrients also is supplied through the ductus arteriosus. Okay, when it is closed after delivery 2 weeks to 3 weeks only this ductus arteriosus is closing. But what happened here? In early weeks of the life baby is survived. Within 1 month baby is going to die. So because of that, because patent ductus arteriosus is closing after 3 weeks, no, child is die immediately after that. So the mortality rate is high in this condition. Coming to the clinical manifestations, neonate may appear completely well initially but becomes critically ill when the patent ductus is closed. Okay, when it is closed means 2 weeks to 3 weeks it is automatically closed immediate after birth. But before that baby is well. After closing only baby is having severe tachypnea due to the congestive heart failure and decreased urine output and poor feeding and feeding intolerance also is there. At the same time child is suffered with the lethargic, change in the levels of alertness, pallor, grey, weak peripheral pulse, and then child is suffered with the cyanosis. Because severe tachypnea and then congestive heart failure child is having going to death. Okay, these are the clinical manifestations of hypoplastic left heart syndrome. Okay, coming to the diagnostic evaluations, first is auscultation. Single S2 usually no heart murmurs is present, and then but occasionally the soft systolic ejection murmurs may be heard. Whenever we are checking the chest X-ray, the cardiac Silhouette varies the normal in the size of the heart is there, and then increased pulmonary marking and then pulmonary edema also we will see in the chest X-ray. And coming to the ECG, it shows that right ventricular hypertrophy, decreased electrical force in V2 and then V6 areas, ventricle sides areas it is there. Okay, this is about the ECG of the diagnostic evaluations. And coming to the two-dimensional echocardiogram with Doppler study and color flow mapping identifies the structural abnormality and then altered blood flow pattern. Okay, this 2D echo will show where the abnormality is there, because they are doing the 2D echocardiogram, no? So it relieves that structural abnormality of the aorta and then left ventricle and then ASDs and then patent ductus arteriosus, everything it will be shows that. And coming to the cardiac catheterization is usually not needed for initial diagnosis. It may be performed if a balloon atrial septoptomy or is needed for the improvement of the oxygenation. So atrial septoptomy they are doing. Okay, this is about the cardiac catheterization. All of you clear? These are the diagnostic evaluations. And coming to the management, that is management is resuscitation and then stabilization with PG1 infusions. Prostaglandin infusion should be needed for those children who are having hypoplastic left heart syndrome, and inotropic support also is needed, that is dopamine and dobutamine medications are needed for the patient baby supportive management, and intubate and ventilate as needed, assess the hepatic, renal and the neurological function. Why here the hepatic and the neurological functions they are doing means here child is suffered with the what happened here, the renal functions impairment is there. Okay, and next one is treatment for the infective endocarditis. Prophylactic management is given, that is long term management is needed, but here the lifespan is very short. and it is referred for the surgical intervention, and then cardiac catheterization is needed, and may need balloon atrial septostomy to allow the unrestricted left atrial to right atrial blood flow. Okay, this is about the medical management. And coming to the surgical management of hypoplastic left heart syndrome, that is palliative surgical management is a staged repair. That is, here the 3-stage repair is there. That is, for stage 1 is a Norwood surgery. Stage 1 surgery they are doing, that is for the neonates, that for the reconstruction of the hypoplastic aorta using the pulmonary artery and then aorta or pulmonary allograft they are doing, and atrial septomy and repair of the coarctation of placement of BT shunt they are doing. Okay, this is done for the stage 1 for neonates, and stage 2 surgery is done for 6 months to 9 months of age group children, that is bidirectional Gallant shunt. Okay, bidirectional Gallant shunt is they are doing for the 6 to 9 months of age group children, and transect the venous, okay, superior vena cava of the right atrial, and then directly they are suture end to side of the right atrium, ligate the BT shunt. Okay, this is about the bidirectional Gallant shunt they are doing. Okay, in third stage, what they are, in which age group they are doing means age in between the 18 months to 3 years of age group they are doing Fontaine surgery. Okay, that is inferior vena cava and then pulmonary artery connection they are doing, that is extracardiac conduit, or they are doing this Beffel surgery. Okay, intracardiac Beffel surgery they are doing. This is comes under the Fontaine surgery, stage 3. This is done for the 18 months to 3 years of age group children. And next surgical intervention is cardiac transplantation. Before that only baby may die. So before that only you should do the cardiac transplantation. That time only we should prolong the baby's or child lifespan. Okay, this is about the surgical intervention. And coming to the complications, is cyanosis and metabolic acidosis, persistent pleural effusion, and then thrombus formation in the systemic venous system, and infective endocarditis, cardiovascular collapse, multi-system failure, and finally the death is there. Okay, these are the complications of hypoplastic left heart syndrome. All of you clear? What is hypoplastic left heart syndrome? It is a congenital abnormalities of the left side of the heart, the underdevelopment of the ventricle and then aorta is there. Before during neonatal period, before 1 month, the baby may having, there is no clinical features. Okay, when the patent ductus arteries is closed, that time only child is suffered with the severe cyanosis. In this case, the death rate is very high. The surgical intervention is the stage required, that is stage 1, stage 2 and then stage 3 is there. The final, that time also is failed, the cardiac transplantation is needed. Okay, in this condition the severe complications is there for those babies. Finally multi-organ failure and then death also is there. Okay, this is about the hypoplastic left heart syndrome. All of it clear?